Hi there. I'm Carrie Miller. I'm a developmental specialist and early childhood program evaluator at UNMC Monroe Meyer Institute. I'm delighted to join you this evening to explore early childhood developmental screening. I understand that each of you joins us tonight with varying experience in regards to early childhood screening tools. So my objective is going to be to provide you with an overview of what developmental screening is and of course why it is important. There are lots of screening tools out there available, and it can be a little bit overwhelming when you're looking at them and trying to decide which one's the best one or which one is right for your program or to meet your needs. What I'm going to do tonight is just give you an overview of some of the tools that are really widely used in this age group or with this age group. And then lastly, I will, of course, touch on some key factors needed for successful screening. You may know, or maybe you don't, that over the past several years there's really been a push to have all children's development screened in the early years. However, with this push for screening comes some confusion. Screening can oftentimes be confused with developmental surveillance, or comprehensive assessment and evaluation. So what is developmental screening? Developmental screening is used to identify children who may be at risk for developmental delays. Screening can also help us to know if a child may benefit from further assessment, evaluation, or additional referrals. A few key components of developmental screening are that these screenings are usually brief. We can usually access them for no cost or an inexpensive fee. And then all of the screeners are usually standardized. If we're looking at using a screener to identify a child that may be at risk for developmental delay, we need to have it standardized against the population. So why the push for developmental screening in these early years? We know that as many as 25% of children who are aged birth to 5 are at risk for developmental delay or disability. If we want to look at even the younger children, those children birth to 3 years old, we know that roughly, or right under 3% of these children birth to 3 receive early intervention services. The staggering statistic is that it's estimated that roughly 10% of these children have a developmental delay. So if we're saying that 10% of children birth to 3 have a developmental delay, but under 3% are receiving early intervention, that leaves a lot of children that have a delay but aren't receiving services. What we know is that the earlier intervention can begin, the more likely that child outcomes will be positively impacted. And then we know there's a societal impact on education that is positive the earlier services begin. Now that we've established or explored the importance of developmental screening in these early years, let's explore a few of the widely used screening tools. The Ages and Stages Questionnaire, or commonly referred to as the ASQ, is a norm-referenced parent report screener that's designed to identify developmental delays during the first 5 years of life. The areas that the ASQ screens are communication, gross motor, fine motor, problem solving, and personal social. It takes about 10 to 15 minutes to complete, and it's about 5 minutes to score. Here's a sample of one of the developmental domains that the parent would see on the ASQ. This is the gross motor domain for the 18-month questionnaire. As you can see, there are 6 questions in this domain, and that's the case for all of the domains for any of the ages. The parent answers 6 questions. The parent's able to answer yes, sometimes, or not yet for each of the items, giving it a total for the gross motor developmental domain, and then that total would be scored against a cut score to tell us if the child could benefit from further assessment. Ages and Stages also has a social emotional screener called the ASQ-SE. The ASQ-SE is also a norm-referenced screener. It's 30 items, and it's intended to identify infants, toddlers, and preschool-aged children that might have social emotional deficits. The ASQ-SE explores self-regulation, compliance, communication, adaptive functioning, autonomy, affect, and then also interaction with people. The ASQSE also has some key items that can be flagged as possibly being red flags for autism. Let's take a look and see what this one looks like. Here you will see a few sample items from the ASQSE. You can see that the parent can answer that their child does this behavior most of the time, sometimes, rarely, or never, and they can also check to see if it's a concern. So as you see, if the parent was looking at, does your child look at you when you talk to him, a parent may say most of the time. The parent goes on to score all 30 items on the screener. The items are scored and compared to a cut score to determine if the child is at risk in the area of social emotional behaviors. The ASQSE is for children 30 to 60 months. However, there's different forms for specific age groups, and the age groups are 6 months, 12 months, 18 months, 24 months, 30 months, 36 months, 48 months, and 60 months. The ASQSE takes about 10 to 15 minutes for parents to complete and then about 5 minutes to score. Next, we'll take a look at the Bayley 3 screening test. The Bayley Scales of Infant and Toddler Development is a full standardized assessment, and the Bayley 3 can be used for screening. There's the Bayley 3 screening test. It's a norm-referenced direct assessment that's designed to determine if a child's on track developmentally in the areas of cognitive, receptive, and expressive language, and then fine and gross motor. You compare the child's scores to the cut scores for the child's age to determine if they fall into the competent, emerging, or at-risk categories. This is a sample of a Bayley 3 screening protocol in the area of cognition. If you can see over here, the Bayley gives you a start point according to the child's age, and then you score it either yes, they meet the criteria that is set out in the manual, set out in the screening assessment, or no, they don't. So it's a 1 point for yes and 0 points for no. You then get a total score and you compare it to the cut score. As I mentioned, then they fall in a category of either at-risk, emerging, or competent. The Bayley screening test can be used for children that are 1 month to 42 months, and unlike the other screeners that we've explored thus far, this one is a direct assessment or direct administration with the child. So the Bayley screening test has a kit that comes with specific materials and gives you a standardized way to present the materials to the child. Therefore, it must be administered by someone that's qualified, either a mental health personnel or child development professional. Hopefully you're still hanging in there with me. Next, we're going to take a look at the brief infant toddler social and emotional assessment, also known as the BITSE. The BITSE is a norm-referenced 42-item screening tool, and it's designed to help you identify child's behavioral problems and competencies. It looks at externalizing problems and internalizing problems, as well as regulatory, maladaptive behaviors, and then it gives you 7 scales of competencies that it looks at as well. The BITSE can be used with children ages 12 to 36 months, and it is a parent report screener. The BITSE is similar to the ASQSE in that it looks solely at social emotional skills and competencies for children. The parent or caregiver is able to rate each item either not true or rarely, somewhat true, or very true or often. These are scored. The score is added and then it's compared to a cut score to determine the child's competencies for social emotional development. Holding true to its name, the BITSE is brief. It takes about 10 to 15 minutes to complete and about 5 minutes to score. Thus far, we've explored some screeners that look at overall development and also ones that look at social emotional development. Next, we're going to take a look at one that looks solely at communication and symbolic development in children. It's called the Communication and Symbolic Behavior Scales, or the CSBS. The CSBS is a 24-item checklist that's organized into 7 different clusters and gives you 3 composites. It screens for pre-linguistic behaviors and skill acquisition, and it may identify children that need further assessment for autism disorders. It's used in children 6 months to 24 months, and it's also a parent report and can be utilized with some observation to complete the assessment. If a parent's not able to answer something, for example, there's an item that asks how many blocks they can stack. Sometimes children haven't had the opportunity to do that, so you're able to then present that and observe how they do. Let's take a look at what the protocol looks like for the CSBS. Here's an example of a few of the items on the CSBS, looking at specifically social and pre-linguistic behaviors. So the parent answers either their child is not yet doing the behavior that is listed, they sometimes do, or they're often seeing their child exhibit that behavior. As with the other screeners, these items are scored, and a total score is compared to the cut score to determine if the child might benefit from further assessment. Next, let's take a look at the MCHAT, or the Modified Checklist for Autism in Toddlers. The MCHAT in the last few years has been revised, so it's now a two-stage parent report screening tool, which means that the parent completes the screening tool the first time, and then if the child fails the screener, then a parent interview is conducted to get further information about the items that are failed. The MCHAT looks at pretend play, communication, and self-stimulatory behaviors. It's important to know that the MCHAT, a failure on the MCHAT or a refer on the MCHAT, does not imply an autism diagnosis. It just indicates that there's a need for a further assessment, a comprehensive assessment for that child. It says right in the manual that it could indicate that the child has developmental delay as well. So oftentimes parents will get anxious when they know it's an autism screener. I think it's important to know that some of the same skills that we look at as indicators of autism can also indicate an overall developmental delay in a child. Let's take a look at the MCHAT. So here is the MCHAT. The MCHAT has 20 items. It's a checklist where the parent answers either yes or no. Some of the items have explanations, for example, right here. For example, if you point at a toy or an animal, does your child look at the toy or animal? These explanations are fairly new to the MCHAT, revised, and have been fairly beneficial to the parents in completing the checklist. So the parents simply answer the 20 questions with either yes or no. Then their answers are compared to the answers that would be anticipated on the MCHAT. And if a certain amount of items are answered opposite of what we would anticipate, then it's flagged as a fail, and then that interview with the parent is conducted to get that additional information about the items, to get a better understanding about why they answered it the way that they did. The MCHAT can be used with children who are 16 months to 30 months, with the target age being 24 months. So sometimes you'll see doctors' offices having parents complete this screening questionnaire at the 24-month checkup. It takes about 10 minutes to complete or less. It's a pretty quick screener for parents to complete. If the interview needs to take place after the completion of the screener, it takes just a little bit longer. The last screening instrument that we're going to explore together tonight is a fairly new screening instrument. It's called the SWIC, the Survey of Well-Being of Young Children. And what makes it unique is it combines all critical aspects of child development into one screening survey. It looks at cognitive, language, and motor development, as well as social emotional development. It has additional section to screen for autism, and then it also looks at family risk factors, for example, depression, alcohol, and drug abuse, and then parental conflicts. And so it's a package deal. It's looking at a lot of the things that each of these individual screeners was looking at all in one. So let's take a look at the SWIC. So here's the SWIC, and I pulled the one for an 18-month-old. As you can see, there's a range. It's used for 18-month-olds to 22-month-olds, just shy of 23 months. So this first section is the developmental milestones, and the parents answer either not yet, somewhat, or very much. So you'll see we have developmental milestone questions. Going into questions about the child's behavior that the parent will answer, not at all, somewhat, or very much. And then they also respond to questions about their observations of their child's social interactions with others. So is your child interested in playing with other children? Always, usually, sometimes, rarely, or never are the options. Looking at some social, pointing to others to show what they want, so some social communication. And then it goes into that, some parent concerns, and then into that family questions section that I mentioned that looks at family risk factors. So I'll just pause there for just a second so you can take a look at that. The SWIC is used for children 2 months to 16 months, and it takes just about 10 to 15 minutes to complete and has a scoring system that is much like the others, where it gets an overall score that you compare. For each of the areas on the SWIC, you compare that to a cutoff score. So that one is kind of the overall package of the other ones that we looked at individually. The SWIC puts them together. Hopefully the overview of these widely used tools has not left you feeling like this little one. As you can see, there's a variety of screening tools available for this age of early childhood children, and I've shared just a few with you, some of those more widely used screening tools. However, more goes into screening, successful screening, than just choosing the tool. When considering implementing screening and choosing a screener, it's important to consider how often a screening tool will be used, how often the screening of children will take place. The American Academy of Pediatrics recommends all children should be screened using a standardized screening during well-child visits at 9, 18, and 30 months. So that's their recommendation, but you would have to figure out what's going to work best for you and figure out what ages your program can feasibly screen children. What you will be screening for must also be considered. Do you want to screen all children for developmental delay, or do you want to screen all children 16 to 30 months for autism? Along the same lines, the age of the children to be screened needs to be identified in order to choose a screening tool that's appropriate for the age range that you're wanting to screen. Lastly, consideration for potential time constraints must be taken. As I mentioned, most screening tools are brief, and as you saw, they can be completed in 5, 10, 15 minutes. So that's brief in comparison to a full developmental assessment, which can take up to an hour and a half for older children. If you want to screen all children who attend a family night, say at the zoo, the Bailey 3 screener may not be the best choice, as it does take a little bit longer. As you saw, it's a 5-area screener that has a standardized way that you present materials to the child. So a parent report or a parent report paired with observation screener might be the better bet for you if you're going to want to screen a number of children in a quick amount of time. So family night at the zoo, you want to pick something that's brief, something that's easy to score, and something that is screening the areas that you want to screen, making sure that you can fit all of the screeners for the children into the time that you have allotted. Additional considerations for screening might be something like, who will you screen? Who will do the screening? Who will score the screening? Now the results, that's another thing. I'm the first one to say that it's much easier to give parents good results from a screener. All parents want to hear that their child is doing well. The results that aren't as favorable are not as easy to deliver, so you must consider who's going to share the results and how they will be shared. Let's go back to the family night at the zoo. If you're having a family social, you don't want to be sharing results in a room where multiple children and multiple families are being screened. You want to make sure that you're being sensitive to the feelings of families who might not be getting the positive news and might be in discussion with you about what's their next step as far as further assessment or evaluation. So for those children who do have a positive screen and might need further assessment or referral, you want to make sure that you know what that process will look like. You want to make sure it's streamlined. So if a child has a positive screen for a possible or potential developmental delay, what's your next step? Who are you going to refer them to? Who's going to make that referral? How are the results of the screener going to be shared? So there's a few things to remember when you're thinking about screening instruments. Screening instruments do not confirm a developmental delay. If you think back to the Ages and Stages questionnaire and we looked at that gross motor domain, it was 6 questions that the parent was going to respond to as far as how their child is doing. You cannot say a child is developmentally delayed in gross motor based on 6 questions. So that kind of puts it into perspective for you. We can't confirm or diagnose with a screening instrument. Kind of leading into, we're not able to establish eligibility for services for early intervention programs using screening instruments either. In order to establish eligibility, we have to use comprehensive assessment data that looks in depth at children's development in order to determine their eligibility for services. And then diagnosis can't be made from screening tools, as I mentioned. For example, if a child fails the MCHAT, additional information and assessment must be completed in order to determine if a child has autism or not. In order to make that diagnosis, we need to have multiple sources of comprehensive assessment data in order to make a diagnosis. I understand that this has been a real brief overview of screening instruments and what some of them look like and how to successfully implement a screening program. So I'm hoping that it has made things just a little bit more clear for you who are less familiar with screening instruments. Hopefully you can see clearly now when we think of screening instruments, much like this little guy when he put his glasses on. My hope is that you have a better understanding of what developmental screening is and why it's important. I think back to that statistic that I shared earlier that children birth to 3, less than 3% of children are receiving early intervention for a developmental delay, but that same age group, up to 10% of children have a developmental delay. So I think that just speaks volumes as to why we have to have appropriate, well thought out screening programs in place for children in these early childhood years. I gave you a little glimpse of what some of the widely used screening tools are and what they look like. I'm going to open it up for questions and discussion here in a bit, and I'm hoping that those glimpses that I gave are just going to springboard us into some discussion and dialogue further about those with questions that you might have. And then I also hope that you have a better understanding of kind of the do's and don'ts of screening, what screening can do and how you can implement it successfully, and what screening isn't meant to be used for. So with that said, I'll open it up for questions. I mentioned that this was brief, and that's intentional. I think 20 or 25 minutes of listening to me talk about developmental screening is plenty. Now I'd like to have a dialogue. I want to know what your questions are and what your experiences are, and make sure that I can clear up any questions that you have or anything that you'd like additional information on. So ask away.